Hello, my name is Cary Adams, and I'm the CEO of the UICC based here in Geneva. As part of the UICC's Road to the Summit, because it's nearly the time for the World Cancer Leaders Summit, I'm pleased to be joined today by Andy Schmeltz. Andy is the Global President and the General Manager of Pfizer Oncology. And as we know, Pfizer Oncology has been a long-time partner of UICC and many other organizations, actually, and helped lots of people in the cancer community. So I'm looking forward to speaking to him today. Now, in his role, Andy leads the team responsible for Pfizer's industry-leading portfolio of 24 innovative cancer medicines and biosimilars. And they reach, on a daily basis, 716,000 people who were touched by their medicines in 2020. But today, we're going to talk about the affordability and access to treatment. We'll talk about COVID and cancer and the learning points we've had through COVID, and also about the innovative partnerships that we've both experienced with a view to addressing the inequities around the world. So, Andy, thank you very much for joining me today. Love to talk to you.
Thanks, Cary. Really, really great to be here. I always enjoy speaking with you and the UICC. And thanks for hosting the World Cancer Leaders Summit. Certainly not ideal that it's virtual once again, but so important to keep the focus on the theme for the meeting, driving innovation to advance cancer control equitably.
Let's start with saying that we're internally grateful to the Pfizer team for producing a vaccine for, which is COVID-19. But also from a cancer community perspective, what do you think has been the learning that you've got through that massive investment in development, the speed at which you did it, the collaborations you put together, and the impact you're having? From a cancer community perspective, what do you think we can really learn?
Well, certainly the pandemic has demonstrated the power of collaboration really to advance scientific research and to truly speed up innovation. We're so proud at Pfizer for our role in being part of the solution in addressing COVID. And the vaccine has showed us that we can move faster than we ever thought we could move before. We can move at the speed of science, and while doing so, maintain focus on both quality and safety. And we really pushed the envelope in several ways here in bringing the vaccine to market. New ways of using digital technology to perform tasks in parallel rather than typically sequentially with clinical trials, and to reduce the white space between clinical trial cycle times. And we're trying to apply all those learnings, now that we've done it, in developing new cancer medicines in our pipeline as well. You know, looking ahead, we know that COVID's going to continue to impact healthcare systems and research communities really for the foreseeable future. But speaking of cancer care, the reality is that's going to continue to be a big problem with the growth in the aging population. Globally, we expect 29 million new cases of cancer by 2040. And for the cancer community, this pandemic has highlighted really what we need to do to work together to remain vigilant and stay the course in our fight against cancer on behalf of millions of patients who are counting on us. And I know that we share that objective.
Absolutely. And I mean, UICC is, got a very heart of its purpose statement is about bringing the cancer community together. And that includes the private sector, that includes the UN agencies, includes the NGOs, patient groups, et cetera, because we believe that we can't win this independently. We've got to work in a coherent collaboration all the way through. Let's move on to the issue of equity, because in the World Cancer Leaders Summit, we're talking about innovation to address inequities around the world. I mean, you've been working, Pfizer, in all different countries around the world. What do you think are the major barriers or the obstacles which really stop us at getting cancer treatment and care to people who are least able to get hold of it?
I think we see, Cary, three main obstacles when it comes to delivering cancer control equitably around the world: logistics, resources, and coordination. We often speak about the difficulties of getting medicines through that last mile. And when infrastructure is in place to get treatments from the centers of care to local clinics, it's really a logistics problem preventing patient access, not a science problem. And this is made even more difficult in treatments for advanced cancers and treatments targeted to specific genes or types of cancer cells. And this is really where the science is going. Here, well-orchestrated infrastructure and including patient navigation help is vital. It's really vital for patient education, for screenings, obtaining medical records, testing, diagnostics, and consistent monitoring of patient treatments and conditions. This is when determined people working together can overcome logistical hurdles and really make the difference between providing access to patients or not getting the treatments that they need.
Yeah, I can agree more, Andy. And one of the things that we, as UICC, we have like nearly 1,200 organizations as members in 173 countries, I think it is. And it's listening to the needs of those organizations who represent the cancer community where we can really make the most impact. I mean, I love living in Geneva and working with WHO, but I know that unless we work on the local challenges, the local problems, the local obstacles, then actually we're not going to achieve the ambition that we want to. So what do you think we can all do in terms of really putting not the patients necessarily at the center of what we're doing, but listening to the local people, the survivors, the representatives of those organizations, the oncologists in those countries? How do we bring them in? What do you think we should be doing?
I couldn't agree more, Cary. Relying on the local community is so very important. Patient education and community networking play central roles, and they're really often underutilized. And that brings me to the second challenge that I mentioned, resourcing, or really the lack of resources. We know prevention and risk reduction plays significant roles in preventing and catching cancer early. But with limited resources, it's really difficult to fund and develop these programs, particularly in low and middle income countries. Effective cancer treatments also rely on early detection and again are constrained in systems in places, and that means that screening and tests need to be readily available, and they are readily available in high income countries. They really aren't accessible in lower middle income countries. And more can and should be done to collaborate and build on existing programs, as well as develop local organizational leadership across areas of health, including cancer. And at Pfizer, we engage at the local level within countries and with patients and provider communities, really seeking ideas and solutions to issues and challenges that are faced daily. Really, the UICC Patient Group Mentoring Program is a great example to strengthen and build regional capacity. And it's great to see the efforts expanding in the Middle East.
Yeah, you said a couple of things there, Andy, which are so true. The first one is that, and certainly UIC has worked on this in the last few years, is that we have to work on the leadership capability, the organizational capability of its members in countries, because it's not just a technical ability. As we're seeing going through COVID, it's been the ability to do tactics, strategies, business planning, fundraising, all these things are important for it to work. But the other thing you said, which I think is really important, is that it's a whole of process approach. We worked very closely with WHO in the last few years to get the elimination commitment to cervical cancer. Well, that can only work if you do vaccinations, early detection, treatment, screening, and screening and treatment. You can't do all bits and pieces. You've got to do the whole package. I mean, the challenge of doing screening without treatment being available is a common problem. So it can lead potentially to worse outcomes of people because expectations are set so high, and then the treatment's not there. I mean, what do you think about that?
Yeah, I totally agree. It all has to come together. It's all about coordination. And that really brings me to this last point of my three on coordination. I think we're seeing more focus on equitable access to treatments and innovative ideas on how it can be achieved. But all too often, we see the initiatives don't work in tandem. They pull resources and support from the same sources, and they really can overload or dilute the impact. And that's where coordination really comes into play. A few years ago, UICC helped launch the City Cancer Challenge to help coordinate efforts directly on the ground for cities prioritizing cancer treatment for their population. I think this is a great example of what it means to do it right. By working with a network of global, regional, and local partners that reflect an understanding of the unique local context, the foundation can coordinate efforts directly on the ground for cities or local communities prioritizing cancer treatment for their patients. That's definitely a step in the right direction.
The City Cancer Challenge, I remember actually talking to your team many years ago, 5 years ago, when we had the first concept. And what was so powerful about that was it engaged everyone. Everyone could see this was the right thing to do, that we should work with cities in low middle income countries, work collectively, let them identify their priorities, and then solve the problems of them keeping responsibility and in charge of it. And we're proud of the City Cancer Challenge and the work that it's done. Tell me, what's Pfizer doing at the moment? Who are you working with, and what are the outcomes of that?
Yeah, here at Pfizer, we navigate really working with local communities throughout regions, lower middle income countries, and identify where the most help is needed and where it will be most effective. And the reality is, while each country and situation is unique, a number of commonalities can be identified and compared across regions and countries. And these data can be used to prioritize action areas, to monitor, to track progress. An example of that is the Breast Cancer Policy Scorecards project, sponsored by Pfizer, that's going to be presented at the summit on October 25th. This project model was piloted in Latin America with the goal of adapting it on a global level. Another example is the Clinton Health Access Initiative and the American Cancer Society's expansion of the Cancer Access Partnership to increase access to life-saving cancer treatments in low and middle income countries, both in Africa and in Asia. This expanded partnership in collaboration with Pfizer and several other pharma companies will make a number of medicines affordably available in low and middle income countries across Africa and Asia. And earlier this year, Pfizer announced a partnership with IDA Foundation to provide equitable access to quality cancer treatments in almost 70 developing countries across all these regions. And I know we're not alone in these efforts and others like them. Pfizer is privileged to serve for many years as a partner and vanguard sponsor with you, Cary, at UICC. And your leadership in global efforts to reduce the cancer burden and growth of more than 1,200 organizations spanning 170 plus countries is critical to the vital progress that's needed. We're proud to be your partner. Certainly UICC has a history of innovative programs to expand access in underserved countries. What's next? What's on the horizon?
Well, there's the good thing about cancer control, global cancer control. There's always a what's next. I mean, we're never going to solve it, and the challenge is just enormous. We can certainly make progress in the right direction. But before I consider what's next, and let me just bring out a couple of things that you said earlier, because I think they're important. Because UICC has a track record of creating innovative partnerships, and we use that to address known problems in global cancer control. We talked about City Cancer Challenge, which was working with cities with over 1 million population in low and middle income countries where we felt collective action can make a difference. We created the McCabe Law Centre, Centre for Law and Cancer, which is in Melbourne. And that's worked with, I think, about 50, 60 governments now, training up their health lawyers to put laws in place which address the risk factors of cancer. Now we've got an alumni of lawyers that are helping each other around the world, really innovative way to address the issue of cancer in the longer term. And of course, we were the founding members of the NCD Alliance, and we continue to play a role there because that's gone from 0 regional and national NCD Alliances to more than 50, I think it is now. And each of them are working collectively in groups which 15 years ago would not work together, the diabetes, heart, cancer groups, all working together on those common issues of access, primary healthcare, national plans, funding, et cetera, et cetera. So we've played a large role in creating innovative solutions through different organizations to address those problems. Meanwhile, of course, UIC has its own core activities of capacity building, advocacy, and some of our work working with our members in countries improving their advocacy skills, whilst we've been working with WHO, has led to a cancer resolution, far more national cancer control plans than there's ever been, more of them funded, more of them integrated into NCDs. So, a real progress we've seen over the last decade through a number of activities, not just UICC, but many other organizations working together in partnership, which I think is coming out as a theme throughout our discussion. But I think as we come out of COVID, I think we've got a time of reflection. We've got governments who have been addressing health as a major, major issue across the whole of government for possibly the first time. It's been stuck in the health department for a long time. And I'm an optimist. I think that the paradigm is changing on how governments will view the way in which we can address health. And as we go through the cancer catch up, because the screenings have been delayed, because people haven't presented early, I think a renewed investment in cancer control and cancer treatment and care will be a natural consequence if we push for it. If we push for it within the Build Back Better. So I think there's a lot that can be done at a national and global level to make sure that we press that. And one of the key things, and something I know that you're interested in as well, is the availability of medicines in low and middle income countries. We know of the basic medicines, the essential medicines less to WHO, less than 50% generally in most of those countries. And these are the ones which are not necessarily expensive, but they're ones that can be used. But the whole of the health system needs to be improved in order to get the right medicine to the right patient at the right time. So I see that as the real challenge that we have in the future. And that's something which UICC will be focusing on through partnership in the next few years.
No, Cary, very well said. And I've got to say, this mindset of transforming the unfortunate, kind of reality of COVID and taking it from a lemon to make it into lemonade. I mean, we're having to quickly learn so much. I mean, I mentioned earlier about the rapid development of the vaccine and now making it available all around the world, taking an innovative, kind of medicine or vaccine, make it available around the world. And we need to harness those learnings and apply them to cancer care. And because if we can do it in the situation of this pandemic, there is no reason why we can't also pull it through in the way we approach cancer care and bring in the appropriate treatments everywhere around the world. So, and I mean, UICC is such a wonderful kind of, bringing together various stakeholders and really convening to make solutions work. So really appreciate that. But bring it a little bit back to getting some input from you. I know at Pfizer, we're always looking for new and better ways to partner with organizations and to deepen the partnerships we already have. So from your perspective, what are some of the gaps you see between UICC and, let's say, the broader pharmaceutical industry that we could perhaps work to address?
Well, I think we're entering a new paradigm of engagement, all right? And I use those words wisely. I think what we've been doing in the last 10 years, which is to deliver support and help into the lower middle income countries, has worked to a reasonable level, and it's certainly making a difference. But we have to face facts. 70% of cancer patients who die are in low middle income countries. And the direction of travel is 70% of those new cases in the next 10, 20 years will be in low and middle income countries because of an aging population, et cetera, and the adoption of Western lifestyles. I think we know the story behind that. I'm not sure that the current models that we have through industry and working with NGOs and others are really geared up to address that tsunami, which is around the corner. I don't think governments in those countries recognize the challenges they're going to be facing in 5, 10, 15 years' time if they don't invest now. So I think we have some key issues that we can only address working in partnership, with Pfizer taking a lead, with UICC, maybe other companies as well, looking at how we change the paradigm, how we make it so we can deliver sustainable long-term solutions with tick some boxes to address where the cancer burden is going to be in the next 2 decades. So there's some unknown questions, and normally innovation is driven by some questions. So I got some questions. I wrote them down so I didn't forget them because they're important. So how do we ensure that essential meds for cancer are available in low middle income countries at a price point which does not bankrupt the government? Okay, how do we do that? How do we solve that problem so that we can get more cancer patients getting hold of the generic and maybe the patented medicines that are available today? And then how do we coordinate in a different way cross-sector? Certainly we're good, I think, in some elements of coordination and collaboration, but cross-sector, it's more difficult, it takes more patience. It needs leaders to step up and say, let's look outside our box and see if we can find more innovative solutions. And the last one is, how do we build off the COVID days to make sure national governments really invest in cancer for the future, recognize that it is the future that has to be addressed now, rather than being focused entirely on COVID. How do we lift their eyes so they're prepared to put it into their recovery plans and build it into their preparedness plans for the future? So I think if we can answer those sort of questions collectively, then we're going to have a far better time at addressing cancer in the future.
Very well said. And those are not simple questions. Those are really meaty questions. But I know I speak for Pfizer saying we want to be part of those conversations. We want to be part of helping to solve and address those questions because at the end of the day, we're all here. What connects all the different stakeholders is to improve outcomes for patients or prevent, the evolution of the disease. And so if we can keep the patient at the center of what we do, we will make an impact. And so we're very proud to be your partner and looking forward to tackling those important questions.
Andy, thank you very much indeed. And again, thanks for being a supporter for so many years. Looking forward to the virtual summit. I'm sure it's going to be great. Thank you for the conversation today. Pleasure to meet you as ever. And we'll stay in touch and see you at the summit. Bye-bye.
Bye. Thanks so much. Thanks for having me.